The time is 10:36 a.m. We're back on the record.
When you talked earlier about training you received before you started promoting products. When you received your training on Exalgo, did you ever look at any of the documents published by the FDA or the CDER on Exalgo?
Not that I'm aware of.
What was your understanding of Exalgo's abuse deterrent properties?
Objection to form.
I can't recall.
Hand you a document that will mark as Exhibit 4.
Do I get to keep these, or are these?
They'll go back to the court reporter, and I'm sure you'll get a copy when you get your transcript.
Okay.
I just handed you a document from the Center for Drug Evaluation and Research. Are you familiar with CDER?
Nope.
This is the cross-discipline team leader review, and if you look on the page 2 of this document, you'll see that it's for Exalgo. Do you see in the introduction, it's the application for Exalgo?
Yep.
So you've never seen this document before?
I'm saying I'm not aware if I did.
Will you flip to page 16 of this document, sir? Do you want to email her and see if she'll want to come back?
Yeah.
About midway down this page, you'll see a paragraph that starts, "The general consensus of the committees was as follows." Do you see that?
Yes.
It says, "In terms of abusability, Exalgo appears similar to OxyContin." Did I read that correctly?
Yes.
Were you aware that the CDER had concluded that the abusability of Exalgo appears similar to OxyContin when you were promoting Exalgo on behalf of Covidian and Mallinckrodt?
Objection to form.
I can't recall.
Elizabeth.
And then it also goes on to state that the committee felt that it has a high abuse potential. Did I read that correctly?
Where is that?
It's in the next sentence beginning. "There was no real consensus as to where Exalgo may lie along a continuum, but it was felt that it has a high abuse potential." Did I read that correctly?
Yes.
And you're promoting to doctors. Do you recall informing doctors that Exalgo had a high abuse potential?
Objection to form.
I don't recall.
In the training that you received for Exalgo, do you recall being trained that it had a high abuse potential?
I don't recall.
Flip to page 18.
Which one?
Page 18. At the bottom of the page, there are some bulleted items. If you go to the 1 to 3rd bulleted item, the beginning of it is blacked out, but it begins with "the human bite force is great." Do you see that?
Yes.
Sentence after that Since crushing the tablet defeats the controlled release mechanism and results in immediate release characteristics, hydromorphone HCI ER tablets will increase the potential risks for overdose or abuse in those seeking to defeat the extended release system. Did I read that correctly?
I believe so.
When you were receiving training on Exalgo, did you receive training that it had this characteristic that it could that the extended release mechanism could be easily defeated?
Objection affirmed.
I don't recall.
Do you recall informing doctors of this fact?
Objection.
I don't recall.
And I think that the record is clear on this, but when we were talking about in-person visits earlier and kind of how those worked, those would have included in-person visits to the prescribers that you visited in Tennessee, correct?
Yes.
There wasn't any difference between an in-person visit in Tennessee or North Carolina in terms of the protocol or your promotional activity?
No.
Flip to page 19. At the end of the bulleted list there, the paragraph beginning, according to CSS. Do you see that?
Yes.
According to CSS, taken together, these findings suggest that the expanded use of this product after marketing raises serious safety concerns and are likely to result in a significant abuse and diversion that further impacts the public health and safety. Did I read that correctly?
Yes.
When you were receiving your training on Exalgo, do you recall being told that it had significant, that CDER had concluded that Exalgo had significant abuse and diversion characteristics,
Objection affirmed.
I don't recall.
and that could further impact public health and safety? Do
I
you
don't
recall
recall.
receiving that? Do you recall ever informing doctors that the FDA and CDER had concluded this?
I'm not aware.
When you were marketing, when you were promoting branded opioids on behalf of Covidien and Mallinckrodt, do you recall receiving training on abuse deterrent characteristics of opioids?
Objection affirmed.
I don't recall.
You don't recall that being an issue in this industry at that time?
Objection affirmed.
I don't know if it was an issue, or I just don't recall whether I got specific training on it.
Well, do you recall it ever being an issue within this industry of trying to develop and promote opioids that had abuse deterrent characteristics?
Not that I'm
Same
aware of.
Did you ever receive training in terms of how to talk about or discuss abuse deterrent characteristics of Exalgo?
Not that I recall.
Yep. Do that every deposition. Every deposition I tell myself I'm not going to mark my copy. And then I mark my copy.
You can just use a different sticker and hold that one down.
We've killed enough trees in this litigation, Josh. Just handed you a document that we'll mark as Exhibit 5. It is entitled Exalgo Learning System, Module 3, Focus on Opioids. Do you see that, sir?
Yes.
Have you ever seen this document before?
If it was part of our training, I may have seen it, yep.
Do you see
Doesn't
it?
ring any bells.
Sure. And do you see at the bottom it says for internal Covidian training purposes only?
Yes.
And this would, we had talked earlier about some training modules, and you had acknowledged that you had at times done some training modules for some of the products that you were promoting on behalf of Covidian and Mallinckrodt, right?
Yes.
Will you turn to will you turn to page 21, please, of this document? Well, let me back up. Turn to the, turn to the table of contents, which I think is on the third page, although it doesn't have a page document. See the table of contents?
Yes.
And this is the table of contents for this training module. And it has 3 topics that are being covered. You had talked about training about disease states and product features. Is this the type of training, or would this be a typical training module to educate sales representatives like yourself on disease states and characteristics of drugs in your promotional activity?
I mean,
Objection form.
without looking at it, I don't.
Well, if you want to take a look at the entire document, feel free to take as much time as you want with it.
Well, what are you referring to specifically? I mean, if you're just saying physiologic effects of opioids, is that what I'd be getting trained on with other products?
Well, you had talked about how before you would go out into the field and promote products for Covidian and Mallinckrodt, that you would get education on the product, its characteristics, and the disease states that it was meant to treat, right?
Correct.
And so I'm just asking if this would be an example of how that information might have been conveyed to you as a member of the sales staff of Mallinckrodt and Covidian.
Yeah, I mean, it looks like it's a training module, number 3, so that would be a safe assessment, yes.
So, and it appears that this has a focus on opioids. See that on the front page?
Yes.
So it would appear that this is an attempt to train staff on opioid characteristics, right?
Objection form.
Sure.
And Exalgo is an opioid, right?
Yes.
And Zardamis is an opioid, right?
Okay. Yes.
So flip to 21. Top of the page, there's a single paragraph, but about halfway through that paragraph, there's a sentence that begins, the development of tolerance. Do you see that?
No, I don't.
You don't see that?
The development
Of tolerance.
in the introduction?
No, I'm sorry. In this paragraph right here, I'm trying to direct your attention to the paragraph or the sentence that begins the development of tolerance. Do you see that?
He's on page 21.
I'm on page 21.
Okay, yep, I see it.
Are you with me?
I am.
And that sentence says, or that the rest of that paragraph says, the development of tolerance and physical dependence does not predict the risk of addiction. In fact, while most patients chronically taking opioids for medical reasons develop tolerance and physical dependence, the risk of addiction is low. Did I read that correctly?
Yes.
So that is what Mallinckrodt is training its salespeople about, the risk of addiction for patients chronically taking opioids for medical reasons, right?
Objection to form.
That's what the paragraph says. I wouldn't say that that's necessarily true.
And well, was that your understanding that the risk of addiction is low when you were promoting opioids on behalf of Covidien and Mallinckrodt?
I can't recall.
You didn't have an understanding when you were promoting these products about their risk of addiction?
Objection to form.
I can't recall the specifics of it at this time.
Do you agree with the statement that appears here in this training module?
Which one?
The ones that we just read.
I don't have a agreement or disagreement or opinion on it.
Do you recall getting training like this on opioids prior to your promotion activity on behalf of it, Mallinckrodt or Covidien's branded opioids?
Objection to form.
Do I remember it specifically? No. Do I assume that I did have training on it before I went out in the field and was promoting the product? Yes.
And would part of that training be the addiction profile of that drug?
Possibly.
Sorry, if you just give me a second, I'm trying to make sure that I keep my documents somewhat in order today. We're done with that one. You can set that aside.
Thank you.
So you've just been handed a document that we've marked as Exhibit 6. It carries a bait stamp number of MNK_TNSTA 085127764, and it's email correspondence that you were on in February of 2012. My question to you is, do you recall seeing this document?
No.
Do you see that your email address of eric.hichman
Very good.
at covidien.com is listed on the as a recipient of this email?
Yes.
Do you have any reason to doubt that that's true?
That that's not true?
That's not true, I'm sorry, yeah.
No.
You regularly used email in 2012 as part of your business responsibilities, correct?
Yes.
So it's actually an email chain here that begins with an email from Christy Woodworth. Do you see that?
Yes.
And it's dated February 28, 2012 at almost 1 o'clock Eastern Time. Do you see that?
Yes.
Do you recall who Christy Woodworth was?
Nope.
And the email is sent to Todd Dean, correct? The first email.
Yes.
And he was your supervisor at that time, right?
Yes.
And this was relatively early in your stint with Covidien, right? February of 2012?
Sure.
You'd been there approximately 4 or 5 months,
Okay.
right? So I want to direct your attention down to the body of the email from Krista Woodworth. Beginning in the first paragraph, she says the sentence beginning, therefore. Do you see that?
Yep.
Therefore, I did some research this morning and found out that your Tennessee territories carry most of this volume. She's regarding the volume for Exalgo. In light of the difficult managed care environment that exists in Tennessee, this is great news. Remember, Exalgo has been preferred on UHC AARP Med D since May 1, 2011. This is a parity position to Opana ER. With the potential Opana ER shortage and resulting confusion, now is the time to capitalize on shifting business over to Exalgo. Did I read that correctly?
Yes.
Do you recall this incident in February of 2012 when Opana ER had a manufacturing facility issue and there was going to be a short-term shortage of Opana ER in the market?
I don't recollect that.
Let's go to the next paragraph, and it says, I've created a little spreadsheet that shows the detail for each of your territories. This details RXs through UHC AARP Med D for only 1 month. 1 month. The potential is tremendous. Double exclamation point. Did I read that correctly?
Yep.
So my understanding of this is that she has taken data she has taken prescription data, right? That's what the RX means, right?
RX stands for prescription, or abbreviator for prescription, yes.
So she has taken data from prescriptions written through this health plan, UHC AARP Med D, for 1 month, right?
I assume so.
And she's looking at that data and determining that if Opana ER is going to be having some problems in the short term, the Exalgo volume could be shifted over, and that potential is tremendous. That's the way I interpret this email. Is that the way you interpret that email?
Objection form.
I don't interpret it really anyway at this point. I don't even really remember anything about Opana ER.
Sure. And so Todd Dean gets this, and later on in the day, he forwards it to you. Do you see that?
Mm-hmm.
I need a verbal response
Yes.
here. And he also forwards it to Chris Clark, right?
Yep.
Who you said was another sales representative who had at some point some territory in Tennessee, right?
Yes.
He forwards it to Teresa Crawford,
Yep. Yeah, she had the Nashville territory.
and she forwarded it to you, right?
Yes, he did.
And then he directs you, well, he says, this is a tremendous opportunity. Did I read that correctly?
Yes.
And he's talking about the potential to sell opioids into Tennessee, right?
Objection form.
I assume so.
And then he directs you, please read below and see the corresponding data, right?
Yes.
If your supervisor in February of 2012 directed you to read and see some corresponding data, do you think that you would have followed that directive?
I may have, yes.
And
Not
then,
necessarily, but could have.
and then do you remember during this time period trying to capitalize on the Opana ER shortage in order to direct more promotional activity into the state of Tennessee?
Objection form.
I don't recall.
As a sales representative, does this at least refresh your recollection that Opana ER was a big competitor for Exalgo in terms of scripts at this time?
Not really. I mean, I couldn't tell you one feature or benefit of Opana ER at this time.
Well, I understand that, but there has to be a reason why the sales team at Covidien and Mallinckrodt at this time were excited about this Opana ER issue, right?
Objection form.
Sure.
I mean, they're talking about it being a tremendous opportunity, right?
That's what they say.
And that would be a tremendous opportunity to increase Covidien and Mallinckrodt sales of opioids into Tennessee. That's the potential here, right?
Objection affirmed.
I don't see that on here. I just see it says this is a tremendous opportunity. I didn't write it, so.
I understand that, but the subject of the email is AARP potential is in Tennessee. 3 exclamation points.
Okay.
You see that?
Yeah, I do.
They're talking about potential for sales in Tennessee of opioids, right?
Objection affirmed.
I would assume so.
And again, going back to the underlying email that talks about Opana ER, it seems like the opportunity here is because there's a problem with Opana ER at this time, right?
Objection affirmed.
That's what the paragraph says, yes.
It also talks about how the South Carolina district is ranked number 2 in the country in terms of Opana ER Exalgo volume, right?
That's what it says.
It says that. And so the South Carolina district was your district at the time, right?
I guess it was.
And then you, along with Chris Clark and Teresa Crawford and Eric Hichman,
Hichman.
I told you I was going to struggle with that today, are presumably the sales force at the time covering Tennessee, right?
Sure, yes.
I mean, why else would Todd Dean send you this email?
Okay.
So, and then based on the data that Krista Woodworth pulled, based on her email that she sent to you, she says, my next question was, which of your specific territories are responsible for most of the volume? Question mark. Right? And then she answers her own question. I did some research this morning and found out that your Tennessee territories carry most of this volume. Right?
Okay.
So here you are, Covidien and Mallinckrodt, February of 2012, recognizing that the South Carolina district is the number 2 ranked in the country in terms of Opana ER and Exalgo volume, according to this email, right?
Objection affirmed.
That's what is being typed. That's what Todd, or that's what Krista has reported to Todd.
And then with a little investigation, she quickly realizes that it's Tennessee that is driving that volume, right?
Objection affirmed.
I would guess so.
And then she forwards that to your boss, who then forwards it to you in order to capitalize on the tremendous opportunity, right?
That's the email says. It's forwarded to us, and it says this is a tremendous opportunity.
And would you describe what you were doing as selling opioids?
Objection affirmed.
I don't understand the question. What I was doing is selling opioids.
Well, your counsel, pretty much every single time I say the word selling is objecting to the form, and I assume that he's objecting because he doesn't like me using the term selling. And so I'm asking you, as a sales representative for Covidien and Mallinckrodt, internally, was it your understanding at the time that you worked there that you were involved in the sale of opioids in Tennessee?
The sales and promotion of the medicines that the company had, yes.
And in fact, that sort of is consistent with Krista Woodworth's explanation here in this email. Again, if you look down to it, the last thing that she says, please let me know if you have any questions, and happy selling, exclamation point, right?
Mm-hmm. Okay.
I read that correctly, right?
Yes.
So she's describing what's going on at Covidien and Mallinckrodt as selling, right?
Objection affirmed.
Yeah, and as a pharmaceutical representative, part of our job was to be promoting a medicine. And as well as educating the physicians, and that's, yes.
And the purpose of promoting was to sell more of your product, right?
Objection affirmed.
That would be part of it, yes.
Well, what's the other part?
Educating the physicians.
But you educate with the ultimate goal of increasing sales, right?
Objection affirmed.
Possibly, yes.
Well, what would be the other reason to educate the physicians if it's not to increase sales of your product?
to help the physicians to have a better understanding about a particular disease state, to help their patients with possible better solutions to problems that they may have. So as a representative, my goal going in wasn't just to sell, if that's what you're getting at.
No, that's not what I'm getting at, but I'm getting at the point that, you know, you got paid a salary, right?
Yes.
There's this robust sales force that's promoting Exalgo out in the medical world, right?
Objection form.
Sure.
And that has to be expensive for Covidien and Mallinckrodt, right?
Same objection.
I don't know the
Would you
costs
get-
associated with it.
Sure. Would you get reimbursed for your travel miles?
No, not necessarily. We were supplied a company vehicle and gas and a gas card, and our insurance was paid for, car insurance, but not reimbursed.
Sure.
That I can recall.
So there's a sales force, and was that consistent with other people in the sales forces that they also had cars and gas cards?
It wasn't exclusive to me.
And so there's this fleet of salespeople with a fleet of cars and a fleet of gas cards driving all over the place promoting these products, right?
Objection form.
Yeah, sure.
And the purpose of that, at least in part, is to drive sales of the products being promoted, right?
Objection form.
That would be one of, that could be one of the drivers with it. Yes, absolutely.
Is it the primary driver?
No. If I walked into an office just purely as a salesman, it's not, that would not be, you know, you wouldn't, we went there to add value to an office, to a physician. And if we weren't there seen as bringing any kind of value from an educational perspective, then we would not be able to go into that office.
Is there anything in this email of February 2012 entitled AARP Potential is in Tennessee that relates in any way to educating a physician?
Objection form.
I don't recall. I don't.
Well, it's not a long email. You can read it. Is there anything in there that remotely relates?
I would say in this email, no.
Almost did it again. So this is an email from April of 2013. It's sent to a lot of people, but I will represent to you that you are not one of them. And it carries a bake stamp of MNKTNSTA 00263679. And it's an email that begins with a lady by the name of Melissa Falcone. And just for clarification, sir, it actually does go over on the next page. This is actually a two-page email.
Okay.
Okay. Do you know who Melissa Falcone is?
I know she was in the with the corporate office. I think she was with training.
And then there's a reply to Ms. Falcone's first email from Susan Stanfield. Do you know who Susan Stanfield is?
I have no idea.
Do you see that she is in her email signature? She describes herself as sales specialist Riverside.
Mm-hmm.
Do you see that?
Yes.
Does that suggest to you that she was in sales?
Sure.
So in this email from Susan Stanfield, it says, I had a couple of physicians ask me if I knew about this. The fortunate thing is most of them assume Exalgo is almost tamper resistant. Did I read that correctly?
Yes.
Was that your impression when you worked at Covidien in Mallinckrodt that most physicians assumed Exalgo was tamper resistant?
I can't
Section
recall.
form.
I didn't write this email, so
I understand.
no idea what she was.
But what I'm getting at is, do you have a recollection when you worked at Covidien in Mallinckrodt, you would go in to these doctors' offices and talk to them about Exalgo, right?
I can't remember exactly what I talked to him about.
I understand that. But you would talk to them about Exalgo, right?
Yes.
And you don't recall whether or not during your time there, whether or not physicians relayed to you their assumption that Exalgo is almost tamper resistant?
Correct.
Do you recall your understanding of Exalgo's tamper resistant properties while you worked at Covidien and Mallinckrodt?
No, I don't recall.
So, going back to the body of the email from Melissa Falcone. Okay, the second page. And just to give you some context, take as much time as you want for this document. She's talking about some recent changes to the FDA regulatory landscape regarding OxyContin, okay? And then here at the end of her email, she has some marketing news. Do you see that? Specific direction regarding this market news.
No. Where?
The very back, right here.
Okay. Yep.
Do you see that?
Yes.
And then she has some topics there. And then one of the topics is if the physician specifically if, I'm sorry, let me rephrase. The email states, if the physician asks specifically if Exalgo is abuse deterrent, do you see that?
Mm-hmm.
She then has two bulleted items. Ensure the physician understands that Exalgo cannot claim abuse, tamper resistance, but there are physical properties to the tablet of which you should be aware. Okay? And then she goes on to describe those physical properties. Do you see that?
Mm-hmm.
And she even gives a script. Do you see that?
Yep.
Section of form.
And it's quote, unquote, and she says, Doctor, while we do not have an FDA-approved labeling concerning abuse potential, you may be interested to know that Exalgo has a hard outer shell that is difficult to crush, and if crushed, it forms large particles. Also, it clumps when exposed to water when crushed. Of course, it is important to keep Exalgo out of the hands of inappropriate patients. However, let's discuss an appropriate patient for Exalgo like the Elaine patient. This is a patient you likely see multiple times a day who may benefit from the true 24-hour dosing Exalgo provides. Did I read that correctly?
Yes.
And that is apparently the script that Melissa Falcone is directing salespeople to use if the physician asks specifically about Exalgo's abuse deterrent properties, right?
Section of form.
I would assume so.
Did you ever use this script or a similar script to describe the abuse deterrent properties of Exalgo?
Not that I can recall.
Would the information that you would have used to describe the abuse deterrent properties of Exalco be provided by somebody at the corporate office of Mallinckrodt, Covidien?
Objection.
Yes.
And if they provided you this type of script, would you use that script?
Objection of form.
It would be an option that we would use, yeah. I mean, it also has in here, refer them to medical affairs, as we have standard response letter. And it also says, ensure the physician understands that Exalco cannot claim abuse, tamper resistance.
Sure. And so, but you don't specifically recall being directed to use this type of script in your promotional activities in Tennessee or North Carolina?
I mean, I can't recall. We are given so many different messages and, you know, with so many different products to say, yeah, that we were told that would be, I couldn't accurately say.
When you were working for Covidien and Mallinckrodt, did you have an understanding that Exalco had a hard outer shell that is difficult to crush?
I can't recall.
And that if it crushed, it formed large particles?
Can't recall.
And that it clumped when exposed to water?
Can't recall.
Do you know if it does that?
I don't know.
Do you recall ever having a conversation with a doctor about the addiction properties of opioids?
A specific conversation with a doctor about it?
Or it coming up in general?
No.
Do you ever recall telling a doctor that Exalco had abuse deterrent properties?
Not specifically.
Do you ever recall ever discussing with a doctor the hard outer shell properties of Exalco?
Not specifically.
If this type of information was on the product sheets, would you have discussed it with the doctor?
Objection of form.
Not necessarily.
Would you ever leave the product sheets in doctors' offices?
I can't recall if I did or not. Like on purpose or accidentally or...
As part of your
Ever?
promotional activities, would you ever leave the product sheet behind?
I can't recall if that was a regular practice or not.
But did it ever happen?
That I'm not aware of. I can't recall.
But it wasn't your regular practice to leave the product sheet with the doctor?
I don't recall.
Do you ever recall directing a doctor to the Mallinckrodt or Covidien website?
No.
Would that have been something that you might have done?
I don't know.
If there were-
Possibly.
if a doctor had a question that you couldn't answer, what would you do?
I believe we would refer them to a medical liaison. Like somebody who's has more specific knowledge about whatever that would be.
Do you recall anybody who worked on the medical liaison team during your time at Covidien and Mallinckrodt?
No.
Would that referral have been via email, or would it have been you just leaving a business card with that person's information for the doctor to call?
That I can't recall. I imagine we would have initiated it just because the, you know, if you just leave it in the hands of the doctor, they got a bazillion things to do, and it probably just wouldn't get done.
So you would try to make sure that the initiative was on Covidien and Mallinckrodt's part in order to ensure that the doctor didn't forget about it in the normal course of practice.
Objection form.
If it was just left for the doctor, then they may not have their question or their concern answered or addressed properly. And again, it goes back to the whole education of the physician, the awareness of products, disease states. So trying to keep the physicians as informed as possible.
In your 7 hours of prep yesterday, did you go over documents?
Yes.
Do you recall going over any of the documents that we reviewed here today?
Nope.
I hand you a document that will mark as Exhibit 8. So this is email correspondence from March of 2013 begins with an email from DJ Horton. Do you see that? I'm sorry, it actually begins with an email from Chris Clark
Okay.
to DJ Horton. Do you see that?
On the back?
It's at the very bottom. You missed it like I missed it.
Okay.
See that?
Yep.
From Chris Clark to DJ Horton.
Okay.
And Mr. Horton at some point became your supervisor, correct?
No. No, he was never my supervisor. He was a trainer. He was never a supervisor of mine. I think he was always in the training department or something with the corporate office.
Okay. Well, do you remember who would have been your supervisor at the time of March 2013?
Paul.
And you say that because he's on this email now?
Mm-hmm.
And he's carrying the signature block of North Carolina Senior District Manager?
He would have been, yes. I don't really see that on here.
So, it's right here in the middle of the page. Paul C. Jones, North Carolina
Okay.
Senior District
Yep.
Manager. See it?
Mm-hmm.
So, do you recall this email?
I've seen this email.
Is this an email that you reviewed with counsel from yesterday?
Yep.
Objection. Go ahead. Instruct you going forward not to disclose any specific documents that we may or may not have shown you yesterday.
So this is an email from Chris Clark. Begins it with a success story concerning a clinic in Knoxville. Do you see that?
On the back?
Yeah.
Okay.
I wanted to pass along a hopeful success story. Do you see that?
Yes.
And then he describes a process where he was able to convert a heavy oxy prescriber over to starting prescribing Exalco, right?
Objection to form.
I think he thought he was going to be able to do that with this office.
Yeah. And then DJ Horton gets a hold of this and forwards it to Bill Nichols, Melissa Falcone, and Paul Jones. Do you see that?
Mm-hmm.
I need a verbal response, sir.
Yes.
And he says, Bill, a great story below from Chris Clark, continued from the events that took place last week. Keep in mind, this is the largest pain clinic in Knoxville, and 80% of all OxyContin scripts in Knoxville County come out of this one clinic. Did I read that correctly?
Yes.
Did you know the clinic that they were talking about prior to this email?
No.
Bearden Healthcare was not ever in your service territory?
Not that I'm aware of.
As you read that today, does it trouble you that there was a pain clinic in Knoxville that was, according to this email, responsible for writing 80% of the OxyContin scripts in Knoxville?
No.
Objection to form.
That doesn't concern you?
Same
No.
objection.
Why not?
Why would it concern me? It's not, if there could be lots of reasons why it would be 80% would be coming out of one clinic.
Do you know if anybody associated with Bearden Healthcare has ever been federally indicted?
I don't know.
And then Paul Jones takes this email and forwards it to you about 10 minutes after he receives it from Mr. Horton, right?
1022, 1032, yep, yes.
And then he says, wonder if the big pain clinic you have in Johnson City could learn for this. I think he probably means from this. Do you see that?
Yes.
And then you reply, I talked with Chris this morning before this email. Sounds like a big glorified pill mill. What did you mean by that?
What I meant by that was that that office sounds like it created a lot of prescriptions.
And you described it as a pill mill. Did you mean that pejoratively?
Objection to form.
Did I what?
Mean it pejoratively?
Same objection.
What's that mean?
Did you mean it negatively?
What I meant by it was that that office created a lot of prescriptions.
But pill mill is your word, right?
That's what I used in this sentence, yes.
And then you say, hope Chris can turn it around. Did I read that correctly?
Yeah.
What did you mean by that?
I can't recall.
So typically when I hear the term pill mill, it strikes me to be a place that might be writing a bunch of improper opioid prescriptions. In 2013, was that your understanding of a pill mill?
Objection to form.
When I wrote this email, what I was referring to was a office that was writing a lot of prescriptions.
Well, then why would the office need to be quote unquote turned around?
I can't recall.
Then you say it could be a big win for him. Did I read that correctly?
Yes.
What does that mean?
I can't recall.
You don't think that it meant that it could be a big win for him in terms of being able to sell more branded Mallinckrodt and Covidien products to this clinic?
Objection to form.
I can't recall what I meant specifically from 2013 in this email.
Well, in a sales representative world, what would be a big win?
Objection to form.
Could be a lot of different things.
It could be the fact that you could be having a lot of sales there, right?
Possibly.
What else could it mean?
Doctors have a better understanding of the medicine, disease state, stuff that I've talked about before already this morning.
How would Mr. Horton know that 80% of the OxyContin scripts in Knoxville came out of this clinic?
Objection to form.
I would imagine, just like with any other company they have prescription data.
And that prescription data was regularly used on the promotional side by the sales team to target doctors, right?
Same
Like
objection.
it was part of the, it was part of the equation. I would I would imagine that would determine how we were going to best spend our day.
And when you say best spend your day, it's because you want to be spending your time with doctors who are most likely to write scripts for Mallinckrodt and Covidien products, right?
Same objection.
What I mean by that is that for me to do my job properly, then I would want to best educate people that are within my territory about Exalgo or any other product or disease state to give them a better understanding. So I wouldn't talk to them. I wouldn't go waste my time with a pediatrician or somebody who wouldn't write a medicine for something that I was promoting.
And that's what I'm getting at. And you know, it's not a trick question or anything, but, and part of using that prescription data was to locate the doctors who were most likely to write scripts for Mallinckrodt and Covidien products, right?
It would probably be one tool.
There's a reference here to the big pain clinic in Johnson City, right?
Yes.
What is the big pain clinic in Johnson City?
I can't remember the name of it.
Is it Johnson City Pain Associates?
Could be. Would guess that's what they were referring to.
I would assume that since Paul Jones, your supervisor at the time, directed you to use this with the Johnson City Pain Clinic, that at this time, at least parts of Tennessee were part of your sales territory, right?
Objection form.
Johnson City would be. I'm assuming yes. Again, I can't remember exactly what my territory was in 2013, but I think that would be a safe assumption.
But Paul Jones, if you weren't in the Johnson City territory, he wouldn't direct you to use this with a Johnson City prescriber, right?
Sure.
So it's safe to assume that as of March of 2013, your territory covered parts of Tennessee.
Yeah, sure. Yeah.
And then that would have included all of that promotional activity we talked about earlier, about the in-person visits
Yes.
and the speaker programs, right?
Yes.
Other than Johnson City, what other territories in Tennessee do you recall covering during this period of time?
I don't recall.
Well, would it have been only Johnson City, or could you have possibly gone up and down the corridor there, the Tri-Cities area?
Sure. Yep.
But based on Chris Clark's email, probably not Knoxville, since he was the one who apparently was calling on this clinic in Knoxville,
Correct.
right? And would that have been like the southern boundary of your Tennessee territory?
Possibly.
But you don't recall the western boundary?
I do not. Again, over the course of 14 years, I may have even had Knoxville at one point. I don't even know.
Sure, and that's kind of why I like to show you documents, because documents help us refresh recollections.
Sure.
This one clearly, you know, shows that you were covering Johnson City in March of 2013. So I'm just wondering if this has triggered something in your mind about what other territories in Tennessee you would have covered at that time.
Yeah.
Objection of form.
Nope.
Going back to the this email in front of you, the March 1st, 2013 email from Mr. Horton to Ms. Falcone, who we've established was somebody in the corporate office, right?
Yes.
Who's Bill Nichols?
He would have been my boss's boss. It's like the regional manager.
And you don't remember what division Mr. Horton worked in?
At this particular time, no. When I first met him, he was the trainer in the home office.
So he was in the corporate office too.
Yes.
Was that in St. Louis at that time?
Yeah.
So beginning the paragraph here in this email of March 1st, the outcome was that the legal consultants, do you see that?
Yes.
It says, the outcome was that the legal consultants gave specific direction to the providers. Quote, from this point on, it's Exalgo and 2 rescues for your patients. Did I read that correctly?
Mm-hmm.
What does 2 rescues mean?
Don't know.
Do you also see that after the breakfast there was, quote unquote, patients were lined up out the door when they were done?
Where is that?
It's in the previous sentence to the one that I just read.
Oh, okay.
Do you see that?
Yeah, Chris said the office was so engaged and interested in how to fix their oxy problem that they stayed in breakfast for almost 2 hours, and patients were lined up out the door when they were done. Sorry.
It's typically why I read the emails, because witnesses go too fast. Does that cause you concern that patients were lined up out the door of a clinic, of a pain clinic,
No.
that had an oxy problem?
Objection.
I don't know if they have an oxy problem.
Well,
How would I know that?
It says it in the email.
Okay.
You just read it. Chris said the office was so engaged and interested in how to fix their oxy problem.
But you asked me if I was concerned that patients were lined up out the door.
Yes.
No.
In a
We've seen it numerous times over my course of 14 years that there was patients lined up.
We're done with that one. Let's go to. Will you confirm that one says 8?
Yes.
This is an email a little bit earlier in time than the email that we were just discussing. It's an email from Todd Dean to you in November of 2012. Do you see that?
Counsel, we get a copy.
Oh, I'm sorry. Did I not hand him over? Sorry about that.
Thank you.
Do you recall this email at all?
No.
So by November of 2012, how long had you been at Covidien or Mallinckrodt at that time?
I'm not sure. I'll have to go back and look and see when I started.
Well, if you go back to your LinkedIn profile, it shows that you had started in September of 11, so you'd been there about a year by November of 12, right?
Okay.
And the email correspondence started with an email from you to Mr. Dean, and it says, "Hi Todd, sorry for the delay, a long day trying to get caught up." Do you see that?
Mm-hmm. Yes.
And it says, "My top accounts for Exalgo and what I plan on doing with them, : Do you see that?
Yes.
And it lists Carla Norma. Do you see that?
Yes.
And it talks about how you want to increase reach and frequency to twice per week and bring in national speaker in January. Did I read that correctly?
Yes.
Does that refresh your recollection that Carla Norma was one of your top Exalgo accounts in November of 2012?
I guess she was obviously one of the, somebody in my territory, yes.
She's not just somebody in your territory. She was described to you by you in this email as one of your top accounts, right?
Okay.
right?
Yeah, sure. According to this email.
And then it talks about how you want to go visit her twice per week.
Okay.
Do you know if you successfully did that during that time period?
I have no idea.
Skip down to Johnson City Pain Associates. Is this possibly the big Johnson City clinic that was referenced in the email we were just looking at?
Sure.
And it says, Johnson City Pain Associates, 7 of my top 15 Exalgo targets are in this practice. Will be in office every Wednesday for the rest of the year and will do one more lunch in office before the end of the year. Did I read that correctly?
Yes.
So, according to November of 2012, this email, Johnson City Pain Associates was one of your top accounts for Exalgo and had 7 of your 15 top Exalgo targets, right?
That's what I have written down.
Will you have any reason to deny that that's the status of affairs in November of 2012?
I think it would be safe to say, to the best of my knowledge at that time, then that would be accurate.
And then you were trying to make sure that you could get into this practice every Wednesday for the rest of the year, right?
Probably looking at the office, Wednesdays were probably the best time to see the physicians that I wanted to be able to see.
And so those 7 that are probably described here, are those the ones that you wanted to see?
I would imagine so.
And then were you living in or around Asheville at that time?
Yes.
How long of a drive is it up to Johnson City from Asheville?
An hour. Just nothing.
And then would that be, while you were up there, would you try to visit other pain clinics around Johnson City?
I would try and visit other offices, yes.
And
Not
that would-
necessarily pain clinics, but
I understand that, but that would include other pain clinics, right?
possibly, yeah. Good.
Do you know how long you continued to visit this Johnson City Pain Associates every week?
No. And I don't even know if I was able to go in there every week. I would imagine in a perfect world, yes, but as we all know, it's not perfect. So, that would have been my goal, but saying it actually happened, I don't know.
And then the email closes with a response from Todd. Thanks, E. Congrats on the extra bonus dollars. Did I read that correctly?
Yes.
Do you remember what the extra bonus dollars was in reference to?
No, I don't.
This would be a good time for another break.
If you need one, absolutely.
I mean, if you have a few more questions or something.
No, it's fine. We can go off the record.
This is the end of Media 2. The time is 11:45 a.m. We're off the record.